Hello, and welcome to our TMA Orientation. My name is Lou Goodman, and I'm the CEO of the Texas Medical Association. Our mission is to improve the health of all Texans, and we do this by providing proactive solutions for the doctors that we serve to provide the highest kind and quality of medical care in the world. Our organization is a grassroots organization, and physicians want to join the TMA and our county societies, which are interlinked and unified, because we provide a number of things they want: ethical standards, policy solutions, practice management, continuing medical education, and a staff that is geared towards service to the profession. We've been around since 1853, and in that time we've accomplished many things. Probably the most recent huge accomplishment is back in 2003 when we passed far-reaching tort reforms, which limited non-economic damages for egregious and unjustifiable malpractice suits against doctors. And since that time, we've had an increasing inflow of physicians to our state, looking at the economic environment, which we don't have an state income tax, which you all know, and the welcoming environment from our county societies, our liability company, our insurance companies, and all our sister organizations. Together, we try to provide, and try is not the word, we do provide an environment where physicians can provide care to their patients in the style that they were trained. Our organization is very democratic. We have a House of Delegates, which you can equate to Congress. Our House of Delegates is action-oriented, and we work together to establish policies and proactive solutions for our members. Our House of Delegates is fairly large. I think the most recent count is 450 plus delegates, which are represented by the county societies based on a representational allocation, our specialty societies, and sections. And the House of Delegates elects a Board of Trustees, which are number 18 currently. And the Board of Trustees have a number of fiduciary responsibilities, and one big responsibility, and that's hiring an EVP, CEO, which is me. And my responsibility is to hire the best staff we can, and I've been very successful in that respect by hiring the best people, best executives and professionals in the country to represent the best doctors in the world. And so with that, welcome to the TMA family. If you have any questions, as you'll see from the other people that speak on this recording, call them up, and they're very willing and very happy to assist you and create an exchange of information. So see you all at one of our many meetings.
Hi, my name is Bridget McPhillips. I'm TMA's Vice President of Membership and Business Development. I've been at TMA for 25 years. In this segment, I'm going to talk to you a little bit about what you're going to learn through this orientation video sequence. So our goal today is to let you know kind of a well-rounded vision of what TMA has to offer you as a county medical society leadership, as a new county medical society staffer, or someone perhaps new to Texas Medical Liability Trust or TMA Insurance Trust. Our goal is to let you know what's available for you to tap into. So for you newly elected county medical society officers, we really like for you to know what's available at TMA so you can draw down the resources to help you be a successful leader at the county level. Like Lou mentioned, we are strong because of our grassroots activity, and one of our primary goals is to make the county medical societies as strong as possible. So with that in mind, I'm going to describe a little bit of what you might hear about today. We're obviously most well known for our legal, legislative, and regulatory advocacy, so you'll hear from the advocacy folks. We also have an incredible array of practice management services available to physicians in their practices. We've got lots of practice management resources that are free and some that we actually charge for, like consulting, so you'll hear a little bit about that. We have a very strong ambassador program where if you want to hold a CME event in your community, we can arrange for a speaker for you on the topic of your choice. So we have a lot of those kinds of resources. In terms of keeping your society operations strong, our COO and his team of CPAs and data scientists will come and actually help you strengthen your county operations as well. They do informal audits of your books. They'll help you set up your databases of membership, that kind of thing. We can also help with communications. We host some websites for counties. So these are just some tidbits of things I think will help you be strong at the grassroots level. We also have lots of public health and wellness activities. Lots of counties host, for example, Hard Hats for Little Heads or the immunization programs. These are things that just give you more visibility at the county level. So as you listen to these sequence of staff speakers, I really want you to kind of pay attention to what piques your particular interest as a county society leader. That way you know who to call, what program you might want to bring to your community. TMA staff is here to make it easy for you. All you got to do is email or pick up the phone and call us, and we'll come to your community and provide whatever resources you need. And again, this is about having you be successful during your county society leadership years. Thank you.
I'm Martha Dance, and I'm the Director of the Office of the Executive Vice President. I've worked for TMA for more than 35 years, and I work closely with your county leaders and staff. We provide staff support to the EVP, Chief Executive Officer of your association, as well as staff services to the association officers, such as the President and President-elect and Speakers of the House of Delegates. We also provide executive staff support to the Board of Trustees, the House of Delegates, the Texas Delegation to the AMA, and the Council on Constitution and Bylaws. TMA remains a strong organization because we are a member-driven organization, or as the EVP likes to say, from the grassroots up. Members of TMA's boards, councils, committees, and the House have a big responsibility to set TMA policy, and they all serve an important role in representing your members. Our team works to keep association policy relevant and your governance structure strong. If your county medical society would like to invite the TMA president to meet with your members, we coordinate their travel and work with other staff to assure your meeting is successful. The TMA president is available to travel to all county medical societies. Get in touch with me and we'll get the president scheduled for a visit. Now you hear from the rest of our team. Please call or email any of us if we can provide support to you or your staff.
I am Diane Arnett, Executive Assistant in the Office of the Executive Vice President. I staff the Council on Constitution and Bylaws. The Council is often referred items related to TMA bylaws from the House of Delegates, Board of Trustees, the President, and other councils and committees. I also assist the incoming TMA President each year with council and committee appointments. I communicate with the county medical societies and the specialty societies throughout the year with reports of their members serving on TMA boards, councils, and committees. Each December, I send the CMS executives, officers, and delegates, and the interspecialty committee delegates the TMA President-elect's official call for recommendations and begin preparing demographic reports to assist the President-elect with appointments. This information helps keep an even representation of the counties and specialties so that the councils and committees can effectively complete their important work, which eventually becomes TMA policy.
I'm Marty Francisco, and I am the coordinator for the Office of the Executive Vice President. I staff the Board of Trustees and the House of Delegates and help keep your meetings running smoothly according to TMA's Constitution, bylaws, and House rules. I review, edit, proof, and check for accuracy resolutions from physician members prior to TextMed, and together with my team, we compile the Handbook for Delegates, which includes TMA reports, resolutions, and elections and informational materials. I also update and maintain TMA's policy compendium and audit trail and ensure that all TMA actions taken during TextMed are followed through with after the House adjourns. Additionally, I manage the House of Delegates Leadership and Policy Index pages on the TMA website, and this is a great resource for our member physicians because there they can learn about TMA policy, where TMA stands on issues, as well as who their leadership is and how they can get involved.
Hi, my name is Bradley Burnett. I am the coordinator of Delegate Affairs and I staff the Texas Delegation to the AMA. I provide administrative services and advice to help the House of Delegates run smoothly and according to the TMA's Constitution and bylaws and operating procedures. I assist the speakers by providing them information so that they can continue to be successful elected leaders. I also provide county medical societies with assistance in preparing and drafting resolutions and answering policy-oriented questions.
Hi, my name is Jared Livingston. I'm an Assistant General Counsel with the Texas Medical Association. There are 5 of us in the Office of General Counsel, so I'm one of them, and we work on different subject areas. I focus most of my time on issues like telemedicine, end-of-life issues, scope of practice issues. What I would do most for counties is probably related to my staffing of the Board of Councilors. The Board of Councilors oversees the county medical societies, including approving their bylaws and issuing the charter for the county medical society, and also merging county medical societies, changing their name. So the Board of Councilors takes care of various things that the county society needs. And when a county society wants to make any changes to its constitution and bylaws, for instance, then the county society would contact the Board of Councilor staff, which includes me and our assistant, and we would work with the Board of Councilors to ensure that the board can review that and approve it and communicate any questions back and forth with the county society until those changes are approved. Any other questions that societies may have relating to the management of their societies can contact Board of Councilor staff as it relates to its relationship with TMA.
My name is Darren Whitehurst. I'm the Vice President of Advocacy and Public Policy for the Texas Medical Association. Do state and federal advocacy, so work in the state legislature and in Congress, and then on the health policy front, focus on issues relating to payment in the Medicare, Medicaid, and commercial market. So during the legislative session, my team works with the Texas Legislature, and on a regular recurring basis, they work with Congress on issues that are important to medicine. During the legislative session, we'll track about 1,500 pieces of legislation that relate to health issues affecting the state of Texas, deal with everything from the budget to insurance to public health to scope of practice. Any issue that you can imagine that involves health, TMA is involved with. As I go out and talk to the county societies, I always preach a message that we're a grassroots advocacy organization. And really, that is nowhere is that more clearly shown than the Texas Legislature and in dealing with Congress. The grassroots model that we involve includes physicians and their relationships with local elected officials, because at the end of the day, the legislators are impacted and influenced by their physicians. I can go out and give them a message, but they really will listen to their local physicians on how the policies that they're dealing with at the state level and at the national level impact physician practices and how they impact the ability of the physician to provide care for their patients. So it is critically important that we involve our county medical societies and our individual physicians in developing and cultivating those relationships. Again, we deal in a relationship-based business, and nowhere is that more clearly seen than in the legislative process.
Hi, I'm Dan Finch. I'm Director of Legislative Affairs for the Texas Medical Association and have been for the last 12 years. Prior to that, I spent 24 years with the Harris County Medical Society in Houston. I cover a broad array of issues, starting primarily with scope of practice issues, which are a regular feature in every session. And it has to do, it is as complex and controversial as nurse practitioner independent practice, all the way down to questions as to whether or not psychologists should be prescribing. We try not to say no. We try to work with all groups to find a middle ground, but there are some principles that our bright line in the sand is this on prescribing privileges. Independent diagnosis and prescribing is the practice of medicine. Physicians may delegate but must supervise because ultimately physicians are accountable. Now, with that bright line, what other issues can we work on together? And we've had some success with both the physician assistants and nurse practitioners over the years taking that approach. It is all meant to foster a more collaborative, communicative patient care team that is, by definition, physician-led. The other issues I deal with are licensure, sunset of the Texas Medical Board, and issues that come up regarding transparency and fairness in disciplinary processes, and everything else related to the medical board, and lately, for the last couple of sessions, telemedicine as well. In 2017, we passed a landmark modernization of telemedicine statutes to define telemedicine strictly as the practice of medicine and regulated in the same manner by the Texas Medical Board, and two, adhering to all standards, accepted standards of care. Telemedicine is neither a lower standard, a higher standard. It is in fact the same standard. Our challenge now is payment related, and that is related to both the Medicaid program and in commercial programs. And we have said that telemedicine is a means to provide a service, and so the broad statement, if somewhat clumsy, is a covered service provided to an enrolled individual by a contracted physician on the platform of the physician's choice shall be paid for. County medical societies and physicians are involved in all of those activities, from staying in touch with TMA, from attending First Tuesdays during the session, where 200 or 400 physicians descend upon the Texas Capitol in the 4 Tuesdays during the session, but most importantly, being involved at the local level to support and elect candidates who are friendly to medicine.
Hi, I'm Clayton Stewart, and I'm a lobbyist for the Texas Medical Association. My focus is private pay issues, such as insurance payments from insurers to physicians. Right now, during the legislative session, insurers are playing every game possible in order to ensure that not only are you not covered for the services that you provide to your patients, but also they put up barriers such as things like prior authorization that get between the physician-patient relationship. These fights are ongoing in protecting your examining room and your practice. What you can do right now is be involved with TMA. Be involved with our First Tuesday process and come down and lobby your legislature. It's one thing for myself as a lobbyist to contact the legislature, but for their actual constituent to come down and explain the issues firsthand makes all the difference in the world. I would encourage you to get involved in that and maybe even take it a step further by potentially being a witness at a hearing over a legislative issue. We appreciate all that help, and also going back to your district and building a relationship there with your elected official as well.
Hi, I'm Michelle Romero, and I'm one of the lobbyists here at TMA. My official title is Director of Legislative Affairs in the Advocacy Division. I work with Darren Whitehurst, and we have a pretty great team. We lobby the Texas Legislature, and my key issues revolve around the Texas budget. Anything with a dollar figure is pretty much my responsibility. And so that has a lot to do with big dollar items such as Medicaid, women's health, mental health, graduate medical education. Those involve funding and appropriations from the House Appropriations Committee and the Senate Finance Committee. So Medicaid is really important for the Texas Medical Association because so many of our physicians treat Medicaid patients, and the Texas Legislature determines the reimbursement rate under Medicaid. And through our advocacy, we try to make sure that the legislature adheres to fairness in payment. And the legislature hasn't approved a rate increase for physicians in the program in almost 20 years. So Medicaid involves children, pregnant women, the disabled. Also, there is funding for mental health through Medicaid. So Medicaid is a big part of my advocacy work for TMA. Graduate medical education is a very important part of our advocacy and working to improve funding for residency slots training, for improvement of training of our medical school students when they graduate. Currently, the number of residency slots to med school graduates is something that we've been fighting for the past few years. Right now we have 1.1 to 1 residency slots for medical school graduates. That's really important because we want to make sure that every single medical school graduate is able to secure, or at least have an opportunity to secure, a residency slot here in Texas. The legislature funds our medical schools and puts in a significant amount of money, and we want to make sure that we don't lose or squander that investment when our medical school students go to other states for their residency. So our advocacy has been very strong on GME funding. We worked on a GME expansion grant program, and the legislature understands the need to continue to fund our residency slots. So that's important. A significant amount of our membership are med school students, and it's important that they have every opportunity to stay here in Texas. And we know that if you graduate from a Texas medical school and you're able to do your residency here in Texas, you're 80% more likely to stay here in Texas. So those are our two big items. Also, women's health. The Texas maternal mortality rate in Texas has reached a crisis of the number of women who die after childbirth. And so one of our big advocacy pieces is to try to extend coverage for women in Medicaid after they no longer are eligible for Medicaid once they deliver their baby, that they're able to continue to receive benefits for at least 12 months postpartum. And we know that way women will be able to continue to receive their primary and preventive care and family planning care, and hopefully if any complications arise due to their delivery, they're able to be addressed within those 12 months of delivering. So those are some of the key items that I work on. Part of my job is really just educating our legislators, and every legislator represents a large group of constituents, of which our physician members are comprised of. They make a big part of their constituent base. Every legislator listens to their constituents, and as TMA being, we say we're about grassroots and we're grassroots driven, they also listen to their grassroots. And so it is, the education is best delivered from their grassroots, and that's you all, and that's our medical societies, that's our medical society staff. I go talk to our legislators, but I am really your representative to them, and developing those relationships with your individual legislators is key to our success here at TMA, and it's key to my ability to do my job to represent you at the Texas Legislature. So it all starts at the county level with our members and our county medical society staff.
Hi, I'm Troy Alexander. I am Director of Advocacy for Texas Medical Association, and I'm pleased to share with you what I do for TMA. A lot of the issues that I work on are related to public health concerns, working with our council on science and public health, as well as a variety of connected committees to that interest, and advising the council on legislation on those matters legislatively, as well as regulatory agencies that touch on the public health issues, such as the Department of State Health Services. You may not remember that TMA actually was originally founded on public health principles and physicians sharing the science of what they were finding back in the 1800s. They shared the info on what towns might be seeing snake oil salesmen, and so really it's still that true today that medicine interacts and works together on trying to protect patients from harmful infectious disease, as well as bad science and things that will not improve health. We want to be a resource for county medical societies on public health issues, and I want to be a point of contact for you to work with you on emerging issues, and as well as things like disaster preparedness and areas that we can try to assist to connect you with the right resources and contacts with the right agencies that may be in your area. I also work on ethics issues like advanced directives, and we have a number of efforts related to that topic, and it's a very complicated topic that we are engaged with that will affect most of your facility physicians, and also involved with business taxes, from everything from franchise tax, as well as formerly we used to have an occupations tax, and of course property taxes are also involved. So those issues are in my area, as well as health information technology, which includes health information exchange of electronic health records or electronic medical records. The issues of HIT are complex, but are also emerging more and more. But we definitely have physicians involved all across the state that we're seeing an increase in physicians who are using electronic medical records, as well as who are engaging more and more in the area of exchange of those records with other entities. And so there's a lot of privacy law, there's law related to what you can do related to that in the state, what the requirements are, consent, and areas of consent that would impact this area. So one of the things you could do to help, you could help us, number one, in helping to identify physician experts on topics related to these topic areas that may be interested or have talked to you about those topics. Please share those with us. Make sure they're involved in the process, because we often need consultation on issues on how it really impacts medicine or where it connects with patients. As well as you can connect with your local HIE. Many areas do have a local HIE. Not all areas of the state have that yet, but some do. And so being involved with your local HIE is a good thing to be in contact with. And to me, communication with us, we have an informal work group that discusses those issues. And so we would want to include the counties that are engaged in that to make sure they're a part of that conversation. You can also track your local tax issues in case things come up. We hear from time to time of physicians complaining that their local taxing authority has begun to tax certain elements of stock, maybe potential for example like vaccines or something to that effect, and we don't know sometimes what a local authority may be doing because we're not able to track all of those individually. So please help us to acquire information as it becomes available to you. So be in contact with us on all these topics, and I'm glad to work with you.
My name is Christine Mojazadi. I am the director for TEXPAC as well as the director for political education. My work with TEXPAC entails helping physician and alliance members identify candidates that are running for office that will work for medicine in its best interest rather than working against medicine. We do this by helping with a grassroots advocacy program in place. We allow for our physician and alliance members to actively reach out to these candidates, meet with them. We encourage them to invite them to their county medical society meetings or have personal one-on-one meetings with them to be able to understand where they stand on medicine's issues. We do this in preparation for the legislative session, as when we have important bills that come up, this helps us because we have already identified those offices that will be with us in our issues, and those that aren't, we know where we can have our friends, we know where we will have our champions of medicine, and so that way we are able to be successful in the legislative session. A great way to get involved this legislative session is by attending First Tuesdays. First Tuesdays is our advocacy program that allows for physicians, alliance, residents, and student members of TMA to come down to the Capitol, meet with your local legislator, and really address the current issues that medicine is facing. It also is a great way for you to network with other members across the state, learn more about the different geographical needs of the state, as well as meeting and forming relationships with your local legislator. Another great way is to be involved in TEXPAC. TEXPAC, as I explained, is the political action committee of the Texas Medical Association, and we are the ones that contribute to candidates and help get those elected that will work with us and not against us. As many open doors we can have in the Capitol, the more successful we will be during the legislative session. Joining is easy. You can go to the website, texpac.org, and joining is only $99 for a regular membership. We have special discounts for students and residents as well as alliance members. And 100% of your TEXPAC dues go towards helping those get elected that will help medicine. in our efforts.
Hi, my name is Bridget McPhillips. In this section of the orientation, we're going to be talking about membership recruitment and retention and all of the various ways we represent and serve all the various segments of our membership. So before we get started and do a deep dive into that, I just want everyone to be aware that 64% of TMA's total revenue comes from dues dollars. So we are definitely a grassroots membership organization, and the way our budget is structured reflects that. So there's a number of ways TMA goes about serving the unique needs of various segments of its membership. We have governance bodies that represent policy needs or service needs, and then we also strive to develop unique services for those members. So we've got a medical student section, a resident and fellow section, young physician section, an international medical graduate section. We're also looking at ways to better serve other populations, including women in medicine. All of the activities are driven by these governance bodies, working hand in hand with TMA and County Medical Society staff and leadership. So you'll hear more about the sections and the activities that they take part in later. We also work to serve the unique needs of various specialties within the membership. I mean, we're a big tent, big umbrella, but we do recognize that different specialties have different needs. Sometimes it's that they need unique CME or they have unique advocacy efforts. We also work really closely with our large groups. We have hundreds of groups in Texas that pay 100% dues for all of their members. When groups get really big, like hundreds and hundreds of physicians, they have educational needs that TMA steps in and fulfills. A good example is years and years ago we took on a large group and they had been capitated in their contracts, and therefore their physicians really didn't have any knowledge of how to code and document and bill. And so when they came on as a 100% group, TMA staff stepped in and worked with them and did specialty specific coding training. So that's just one example of serving a unique need. Something that's in really high demand right now is leadership development, leadership training. You'll hear more about this in a few minutes. We have a TMA Leadership College where we do leadership development for young physicians. We're also looking to expand our leadership development training right now and do more lifelong leadership development. And also advocacy training, get more physicians involved in our advocacy efforts. And also leadership in value-based care environments. There's a high demand for that right now. So there's lots of exciting, tangible products and services that you'll hear about. And with that, I'll turn it over to the team. Thank you.
Hello, my name is Sylvia Salazar. I'm the Associate Vice President for Membership and Leadership Development at TMA. And my team is primarily responsible for all recruitment and retention activities. But additionally, we staff several representative bodies here at TMA. That includes the medical student section, the resident and fellow section, the young physician section, the international medical graduate section, and hopefully soon a women in medicine section. Additionally, my team works very closely with the county medical societies. We work very closely with our 100% large group practices. And we also provide services to the counties like our ambassador program, which provides staff experts as speakers to local county medical society events. And you'll hear about that more later from some of our team. Additionally, one of our newest programs, or it's been around a little bit, I guess this is our 8th year now, but a very highly regarded program is the TMA Leadership College. And again, you'll get to hear more about that later. One of the things I want to focus on with you today is our help to county medical societies. We provide a wide variety of resources. Some of those you'll hear about a little bit later. But what I wanted to say primarily is that please feel free to give us a call because we are here to help. If you need assistance with recruitment and retention activities in your area, or if you need help to just make sure that you're providing value locally for all of our members, or if you need help with just the day-to-day management or organization of your county medical society, we've got resources that should be able to help you with all of those things. We're only an email or a phone call away, so please feel free to give us a call, and we'll be glad to help you in any way that we can. Thanks so much for your service and all that you do for TMA and your County Medical Society.
Hi, my name is Melanie Harrison. I'm the Membership and Leadership Development Manager here at TMA. In that position, my duties are split in two ways. So one of my main pieces is being the staff liaison for the young physician section. Young physicians in TMA are those who are within their first 8 years of practice or under the age of 40. The young physician section is a great opportunity for these physicians to network. We meet at each of the TMA conferences. They have a mixer, they have their business meeting. It's also a really great way for them to become involved in organized medicine and kind of get their feet wet in the policymaking side of things. They pass resolutions, they debate the issues, they have educational programming at a lot of their meetings. So it's a really great opportunity for them to broaden their scope, meet other physicians, and really kind of expand their knowledge base in both their career and within organized medicine. The other main piece of my duties is the TMA Leadership College, which again is focused on young physicians, so only those who are within that first 8 years of practice or under the age of 40. But it teaches the fundamentals of leadership and strengthens their abilities to lead both in their practice and prepares them to lead, again, in organized medicine, whether that's through TMA, whether they want to get involved on the national level, within their specialty societies, or even within their county medical societies. It's a year-long program, and it, in addition to just those leadership soft skills and the preparing them to move forward in their career, it's also a unique opportunity to network with other physicians from around the state. We have physicians in every specialty from all different types of practice settings and from different rural versus urban areas. So it's a great opportunity to hear about the different challenges that are facing physicians and how people are being challenged to find solutions for those issues. And it's just a really unique opportunity to grow and to learn from and alongside their peers. Another newer piece of my duties is the Women in Medicine programming at TMA. This is something that has come about through a lot of discussion with the membership, and it's something that we're really excited about moving forward and hoping to expand and meet those needs of the women physicians who have definite policy interests and unique challenges as they move forward in their careers.
Hi, my name is Karen Kohler, and I am the Sections and Outreach Manager for the Membership and Business Development Department of TMA. I staff the Ambassador Program for the Texas Medical Association. The Ambassador Program provides resources to help county leaders run successful societies on the local level. Some of the resources that we are able to provide through the Ambassador Program include live presentations, free CME opportunities, strategic planning, and more. Some of the things you can expect if you were to coordinate a presentation through the Ambassador Program is help announcing the presentation through email and also through posted flyers. You can also expect that the presentation will come with CME reporting opportunities and evaluation forms so that we're your one-stop shop for free CME on a local level. I also staff the Medical Student section, the Resident Fellows section, and the International Medical Graduate section. As staff for these sections, I coordinate all section activities including recruitment, meeting preparation, communication of all opportunities provided through these sections, and so much more. Section involvement provides benefits to members through networking, opportunities to formulate policy, leadership opportunities, and so much more.
Hi, my name is Heather Betteridge, and I've been at TMA since 2005. I am TMA's Associate Vice President of Practice Management Services, and that means I direct a team of full-time consultants who average more than 20 years experience working with physicians in their practices. I staff the Council on Practice Management Services who direct our activities and products. I oversee the TMA Education Center and the staff who develop and manage TMA's practice management education. And Cheryl will speak to that in detail in a few minutes. We offer about 20 different consulting services, from new practice startups, assessments of revenue cycle, daily operations, online presence. We also provide services for staff recruitment, quality payment programs, accreditation guidance, HIPAA, OSHA compliance, coding and documentation. All of our services are tied to membership and our fee for service. So that means that, one, they need to be a TMA member in order to utilize our services, and there is a fee above and beyond membership dues. But because TMA is a membership association, practices find that our fees are significantly below market rates. All of our consultants are TMA employees, meaning we do not outsource to third parties, so we monitor and manage quality closely. We also have hands-on experience working within a variety of settings, from solo and small group practices, larger multi-specialty groups, facilities and hospitals, and within management service and billing organizations. We bring extensive experience in overcoming operational challenges. We have a working knowledge of best practices or policies and procedures. And each consultant has a niche in which they specialize, such as billing and collections, coding and documentation, human resources, clinical processes, quality, and so on. So projects are assigned based on the practice's needs and the consultant's capacity and availability. We provide a number of staff trainings, including customer service, revenue cycle management, internal controls, non-physician practitioners, HIPAA, MACRA, MIPS, and more. And if there's a request that we don't already have developed, we're happy to create trainings on request as well. We also offer starting in medical practice programs, and these are a compilation of about 10 one-hour seminars for early career education. And this is where the TMA consultants or select speakers travel to programs across the state, and this is at no cost to the programs, and we speak on topics that help new physicians transition into practice, whether it's private practice or employment. And to go along with these seminars, we do have a 50-page printed guide entitled FAQs for New Physicians Starting Your Career. If you have any questions or know of a physician or practice that could benefit from our content experts and hands-on assistance, please have them contact TMA Practice Consulting at 800-523-8776 or email practice.consulting@texmed.org. Thank you.
Hi, I'm Cheryl Kroviak, a Program Manager in TMA's Department of Practice Management Services, and I manage TMA's Education Center. I've been with TMA for 20 years. As a manager of the Education Center, I work with other TMA staff and our learning management system provider to ensure educational programs are easily accessible to our members. I also look for new education that we can develop or provide so that TMA's Education Center covers a wide variety of topics and interests, and that the programs are available in multiple formats, such as live and on-demand webinars, print and PDF publications, podcasts or audiocasts, and as needed, even in-person seminars. Ideas or need for education come from all over, most often by information gathered from the field by county medical societies and TMA staff, or from input from TMA's councils and committees, and even from calls from the TMA Knowledge Center. Like most of us in the association world, I wear multiple hats. In addition to managing the Education Center, I also produce webinars on practice management topics that address the business side of medicine. And I'm always looking for ways to engage more physicians in using the Education Center, so I frequently have a hand in marketing. The TMA Education Center is a rich resource for physicians and their staff. And thanks to the generous sponsorship from TMAIT, the Insurance Trust, a large portion of our programs are free for members and their staff. Some of our most popular programs are on physician health and wellness, legislative changes, like the recent update on DNR orders that came from the 85th legislative session, public health matters like diabetes and nutrition, and risk management and compliance, such as HIPAA training, delegation of duties to NPPs, and using social media. With the variety of delivery formats and hundreds of CME hours, members have a go-to place for on-demand help and education. Reach out to me with any ideas or questions about practice management education or anything in general about the TMA Education Center.
Hi there, I'm Shannon Vogel. I'm Director of Health Information Technology and Special Projects. I've been at TMA since 1999, and we also, in addition to our Health Information Technology Department, we have a Health Information Technology Committee that oversees a lot of the work that we do. First and foremost, we focus a lot on advocacy. We want to make sure that our members are well represented, whether it's through state and federal policy, legislation. We do review a lot of regulations and write comment letters. Those comment letters are posted publicly on our HIT page so that at any time you can see what we're saying about different issues related to HIT or Health Information Technology. Speaking of resources, if you go to our HIT homepage, which I believe the link has been provided for you, but it is simply texmed.org/HIT, you'll see various topic pages that we have linked from there. So for example, we have pages about EHR adoption and implementation, MIPS, which is one of the Medicare incentive programs and helping physicians comply with that, e-prescribing, ransomware and cybersecurity, and also technology and patient safety. Just to give you a few examples of some of the resources that we provide for our members, and when you look through those pages, you will see a lot of resources available. We try to organize them as best we can so that you can get to what you need immediately. But for example, we have done an EHR comparison tool. And over the years, the HIT department began in 2006, we have collected data on what EHRs physicians are using. And we take that data and we compare the most utilized products. We compare by functionality and by pricing so that a physician can, as basically an apples to apples comparison, look at different products when shopping for an EHR. We also have a lot of tools related to the federal incentive programs. I mentioned MIPS, which is an incentive program where physicians can receive incentives but also be penalized for not participating. But we provide a lot of tools around what it takes to participate and just try to take the federal language and distill it down to where it's easy to understand, easy to follow. Wherever we can, we try to do just step by step what you need to do. Another very popular resource is our EHR Buyer Beware guide, which looks at contracting terms that are common in EHR contracts. So many times we hear from members that are having a bad experience with their EHR vendor, and our first question is always, what does the contract say? So we really want to be actively helpful with our members around contracts. We have a relationship with a company called Coker Group that will review technology contracts for free for members, and then they make money if those members need negotiations for those contracts. Some of our resources provide CME. So another example is we have our EHR implementation guide. We are now on the 4th edition of that guide as we update it to reflect what is going on in the marketplace. But that comes with CME. We have another new publication about switching EHRs. We have recognized that now that physicians have become active users of EHRs, once they've purchased and they start to use it, they realize that there's certain functionality they wish they had that they don't. So they start shopping around. And of course, the transition of patient data from one EHR to another can be pretty cumbersome. So we try to help guide the process and give them some tips and tools to think about. But we do webinars, publications, ambassador programs where we'll go to county medical societies and provide CME and just try to help our members wherever we can. Another thing that we have done since we started our department is we do a biennial EHR survey or HIT survey, and we look at physician EHR adoption rates. So when we started the department in 2006, approximately 22% of Texas physicians were using an EHR. We have now seen that number grow to 85%, which we're really happy to see, but of course with it comes a lot of questions. And speaking of questions, we do have a helpline. Physicians can access us either by email or by calling an 800 number to ask questions. And I'll just give you one example. We had a member one time, he was trying to find out, it was really a pretty simple question related to one of the EHR incentive programs, but it was a very important question and clarification that he needed. And he was trying to reach out to CMS, Centers for Medicare and Medicaid Services, to ask this question. And he was looking on their website, and then he called our helpline, and it was an answer that I knew right off the top of my head. And the member commented, he thanked me, and he said, "You were able to answer in 20 seconds what would have taken me hours to find through CMS." So he was extremely grateful. And we always commit to our members that if we don't know the answer, we will be a resource to help find the answer for them. And we've done that many, many times and are glad to continue to do that. So please send any questions our way. We're happy to help. Also, as part of my special projects role, I oversee the vendor program for TMA. And so we have endorsed and group discount vendors as a member benefit. And I just want to stop for a minute and talk about two companies, TMAIT, Texas Medical Association Insurance Trust, and Texas Medical Liability Trust, TMLT. Those are both insurance companies that were created by TMA for TMA members. And so those two companies have exclusive endorsements with TMA. We don't endorse any other insurance products, but these are places where physicians can get whether it's health insurance, life insurance, financial assistance through TMAIT, as well as other insurance product lines, or their medical liability insurance through TMLT. So you will see TMAIT and TMLT prominently displayed at our meetings, throughout our website, and in our magazines. They are very special and close to TMA, and again, a premier representation. But we also have other vendors to help physicians in their practice of medicine, the business of medicine, and again, as a benefit of membership. So for example, we've negotiated discounts on websites, electronics, scrubs, magazines, credentialing, collection services, credit card processing, even LED lighting. We also have what we call lifestyle vendors, and these are vendors that basically are used to enhance a physician's lifestyle. So for example, we have luxury travel options, both domestic and international. We have hotels, auto leasing that are available for our members. All of those companies go through a rigorous due diligence and then are approved by the Council on Practice Management if it is a practice management product or service, and then through the TMA Board of Trustees, who has oversight of all of those programs essentially. At the end of the day, we just want to make sure that our members can be successful, and we want to provide tools, resources, access to whatever we need to help them be successful in their practice of medicine and whatever they need to do that we can assist with. So thank you, and if you ever have any questions, do not hesitate to reach out to me.
My name is Casey Harrison. I'm the Director of CME. So I work in the TMA CME department, and our department has two different roles. We are an accreditor of organizations in Texas, and we also have a CME program. We accredit on average about 55 organizations. Resources we have available for organizations interested in becoming accredited are located on our website under CME for CME providers. And the only time that usually I will reach out to county medical societies is when we are in town doing a site visit at one of the organizations. We'll reach out, ask if there's anything we can do to help you, bring any resources to you, but that's usually when I'll reach out. But I would like to introduce Paige Green to talk about our CME program.
I'm Paige Green. I'm the CME program manager here at TMA, and we really have two different areas where we're supporting the physicians in Texas. The first of which is our directly managed program, and that's where in-house TMA staff come up with topics and we develop them for CME, and that's usually in practice management or physician health and wellness and legislative and leadership types of topics. And then we have another area, and that's where we're supporting the county medical societies and the state specialty societies through our joint providership program. And in joint providership, the originating entity comes up with the content. So it would be, with the county medical societies, it would be your physicians that are coming up with the content area that you want to talk about, and you develop the agenda and all of that, and you would just come under the TMA umbrella of accreditation in order to be able to offer AMA PRA Category 1 credit and ethics credit. One caveat about that is give me some lead time, because I'm just one person and I manage all of TMA's program as well as all of the joint providership. So the more lead time you can give me, the better. Thank you.
Hi, I'm Anthony Chappell. I'm the Senior Associate Vice President for Medical Economics here at TMA. The Division of Medical Economics represents TMA at the state and federal level on regulatory, socioeconomic, and health policy issues. We participate in the development and implementation of association policy on Medicare and Medicaid, various reimbursement issues, and managed care, just to name a few. The division staffs the Council on Socioeconomics, the Committee on Rural Health, the Committee on Medical Home and Primary Care, the Select Committee on Medicaid, CHIP, and the Uninsured, and the Patient-Physician Advocacy Committee. Staff in Medical Economics provides hands-on assistance to physicians and their staffs. We are here to help you and your staff stay current on the ever-evolving changes in the regulations impacting medicine. In addition to the policy side of the advocacy, we also develop webinars and calculators and seminars to assist you in your practices. The Medical Economics Division also conducts a biennial survey of the membership, gathering a ton of data of real live, what's happening out in the field, information and data that we use to inform our policy making and sort of our assistance with our legislative efforts. Once the data is scrubbed and prepared, we can come out upon your request and provide some presentations on what we gathered that you may find helpful and interesting. As an example, in 2017, we did a special survey following Hurricane Harvey of the physicians who were impacted by that, and we were able to get information that was useful to state and local officials as well as the public and the media on what impact this was having on physicians and the ability to deliver care in those areas. And lastly, we have the ability to and welcome an opportunity to come out to the medical societies and just have one-on-one dialogue. Texas is a huge and diverse state, and the issues impacting physicians vary by geographic region. It is helpful to us to get a real live understanding of what's happening by coming out and meeting with your staff. I met with staff in the Harris County Medical Society this past fall, and we had an incredible conversation about prior authorization, which is a menace to everyone who's practicing medicine. That conversation informed work back here at the association in conjunction with the lobby team and with our legal department in drafting some legislation that we all think is going to have a very positive impact in that area should we prevail in getting it passed. I applaud the Harris County Medical Society staff for bringing this issue to our attention and emphasizing the importance and providing some data to us about what was happening down there to their members. So I invite you to invite us out for a dialogue, and thank you very much.
My name is Genevieve Davis. I'm the Associate Vice President of Payment Advocacy here at TMA in the Healthcare Financing Department. One of my primary roles here at TMA is to work on anything related to private insurance or with Medicare. I have 2 certified coders on staff who assist with inquiries that we receive from members and their staff regarding claims issues, not understanding why the insurance isn't paying for something, things like that. We also staff the billing and coding hotline here at TMA, so any TMA member or TMA member staff can contact us and ask questions about not understanding why a CPT code is not appropriate to not understanding why an ICD-10 code might not be appropriate. One of the great things I think about the assistance that we offer to our members is that it's unlimited assistance. We don't say, I have people ask me, so does that mean I can only call you 10 times a year? And no, you can call us anytime. There's no limit. We want to help you. We're here to help you. We have people that regularly contact us and keep us updated. And I like to establish those relationships with physicians and their staff, because without their contact with us, I don't know what's going on out there in the day-to-day practice operations. I don't know what the health plans are doing. So I need that interaction, and we foster that relationship through my department. County medical societies, one way is definitely when you have members contacting you with questions that you might not know how to answer, don't hesitate, direct them to call me. Or if you have questions that you've heard come up at a county medical society meeting or chatter in the community about something, let us know. The other thing is you can reach out to us and find out, get a general idea, is there anything that maybe you need to alert your members to? Are we aware of anything going on that would specifically impact your county medical society? And then the other thing that we always need County Medical Society assistance with is promoting our TMA Hassle Factor Log program. And that's one of the great benefits of membership at TMA, and that physicians can send claims issues to us through the Hassle Factor Log program. And one of the certified coders will look over the claims issue and either provide education back to the practice as to why the claim was not paid or will not be paid, or if the claim should have been paid and the health plan made an error, then we will contact the health plan on the physician's behalf to try to get the issue resolved. We have a really great success rate with that program. Averaging over the last 2 years, I'm happy to say, over $1 million in collections for practices. And once again, it is a benefit of membership. So it not only benefits me to promote it, but it definitely benefits you at the local level to let your physicians know that that assistance is available.
My name is Mike Hebert. I'm the Associate Vice President of Membership Operations and Business Intelligence. I've been with TMA for 16 years. We have 5 staff people, ranging from basic data entry to highly technical business intelligence. On the membership operations side, we're responsible for all of the dues invoicing, dues collection. We also send over 300 group invoices, the single group invoices to the groups. We maintain the rosters for those groups. We're responsible for the data integrity in our IMUS database. We also process all membership applications. We enter all the data off of those applications. Those applications are then sent to the County Medical Society for their approval. So until the county approves those applications, they're not actually members in our system until we get that approval. For the counties, we also do web development and web content. I have a staff person who's really good and works with our web developers. Once the website is set up for the County Medical Society, then he goes ahead and works with the county executives who tell them what content they want on their website, and he will go ahead and update that at their direction. On the business intelligence side, we have a full-blown data warehouse with a data store that actually allows us to track data over time. So at any point in time, going back for the past 10 years, we can say where was a member at this time, what county medical society were they in at this time. Any of the data elements that we track those changes on. So that, in a nutshell, is what we do in operations and business intelligence. We do a lot of reporting for the staff. They have our phone numbers. They also have a TMA help desk where they can email it. We get a large number of requests for data, mainly membership rosters, different data elements such as how long have they been TMA members, And what we can do is we use a product called Microsoft Reporting Services. That allows us to not only set the report up, they can access it through the TMA portal that they're given to, or the report can also be emailed to them on a schedule. So we can email the report to them once a week, once a month, whatever they prefer. We process literally thousands of reports for the counties. And we also travel a lot. One of the CPAs, myself and John Dorman, our Chief Operating Officer, we frequently travel to the counties. We work with them on their finances. There's been many counties that we set them up on QuickBooks, and we go ahead and help them do the QuickBooks, and then I go and I train them on our database, on Microsoft products, and any help that they might need. And then again, there's also the web portion of it where we provide a free website for the county, and we go ahead and we edit the content, whether it be a calendar or their officers, whatever they need on that website, we can edit that. We currently administer 8 counties that they have decided to let us go ahead and take over their membership operations part of it. So for them, what we do is we process all the applications for them. We process their dues. In some cases, we keep their dues here, almost like a bank, and then we will write checks for them if they need it. Other counties prefer to have us send the money to their president, and their president will keep that money in their own bank account, which is fine. But the lend-a-hand, it takes away having to have an exec working for the county that will do the basic paperwork that needs to be done.
My name is Dale Kilsby. I'm the Director of Accounting here at TMA. I've been here over 20 years. Here at TMA, I work with in the finance department. We do the budget, the pension plan, finance, investments, but we also help and assist our counties. And part of my job is kind of expanded out to assist the counties in the financial needs they might have, such as assisting them with setting up QuickBooks and getting their organizational finances in proper order so that they're according to accounting principles. We also assist with taxes and helping with the 990 tax return, which is a requirement. We don't actually do the taxes, but we can assist with that. Our QuickBooks that I mentioned earlier, that program is actually connected to our IMUS membership database system, and data is actually uploaded hourly from our membership system to the QuickBooks, recording a receivable from TMA and your dues income on the other side, so that data entry is not required. Money transactions move over and money is transferred weekly. This assists our counties so that they don't have to do the day-to-day financial task.
Hello, my name is Sarah Regalado, and I'm the Director of Conference Management at the Texas Medical Association. The department's primary responsibility is to oversee the management of TMA's 3 annual meetings. TexMed, which is TMA's largest meeting, happens in April and May of each year, and 2 leadership conferences that are held each fall and winter. TexMed is the annual meeting of TMA's House of Delegates, which is TMA's policy-making body. It also offers an opportunity for the boards, councils, and committees to meet. It has 2 days of CME programming, and all of this is supported by an expo hall of over 100 vendors. Our conference management department is made up of experts in meeting logistics, hotel contracting, continuing medical education, and overall meeting management. We work with experts around TMA to provide professional conferences and create positive experiences for our members. All 3 of our conferences are free to TMA members and provide a place for continuing medical education, leadership opportunities, and cross-specialty networking. Our team supports TMA staff and physicians to ensure that TMA initiatives move forward.
Hi, my name's Steve Levine. I'm the Director of Communication here at the Texas Medical Association. Our job is, in a nutshell, 2 parts. 1, to make the Texas Medical Association look good to Texas physicians, and 2, to make Texas physicians look good to Texans. It's all about image, it's all about service, it's all about bringing those two things together. We devise messages, we work on message delivery systems, whether it's magazine, email, social media, website, in-person, speeches, what have you. The delivery mechanism really doesn't make a difference. It's just trying to make sure that we've got a consistent message to our members about the things that TMA can do for them and why they need to get involved, and a consistent message to the public about what healthcare is about, what's going on in the healthcare system these days, what physicians need to be able to take better care of their patients, and how TMA is working to help that. You'll hear in a little bit from two of the department directors at the communication division, but I want to touch on a couple things that sort of cross over everything that we all do. In this day and age, obviously electronic communication is one of the most important ways that you can reach people. We've got a very sophisticated email delivery system, which includes not only a daily newsletter, but targeted email. So, for example, if need be, we can send an email only to the left-handed pediatricians in Reynolds County. Well, maybe not quite that targeted, but I think you get the idea. We also use social media quite a bit. TMA has a very active Twitter feed, which is primarily aimed at the external world, because politicians and elected officials have found that Twitter is their social media platform of choice. So we do a lot of externally oriented messaging on Twitter, and we encourage physicians to retweet, like, share those messages. We also have a very large Facebook audience. That is mostly internal, aimed at the family of medicine. You'll see a lot of posts there that either make doctors feel good, remind them what TMA is doing, tell them about TMA meetings and events, share news articles that we think they might want to share. There's also our YouTube channel, which is fed with several new videos every week, and we have a LinkedIn channel, and we also have an Instagram channel. So I encourage you to follow us on all of those, and to encourage your physicians to follow us. Obviously, no electronic communication these days works without a home base. TMA's home base is our website, www.texmed.org. All of the materials that I've been telling you about live on the website, as well as on any of the other medium that we may use to distribute them. The homepage is really a picture window into the various different projects and services, news and advocacy that we're engaged in. There's no way in the world that we can put all of even the day's news right there. You will find important sections on advocacy, practice help, complete links to all of our CME, public health activities, etc. on the website. And of course, the easiest way to join TMA or to renew your membership to TMA is on the TMA website as well. For our physician members, the most important message that I've got is that TMA tries to arm them with the information that they need to talk about complicated healthcare issues to the public, to their patients, and with each other. We try to make sure that our members have the most important breaking news that affects what's going on in their practice, whether it's a change in government regulation, whether it's a public health alert. All of those things are important for our doctors to have, and we use as many different tools as we can to get it to them. Let me give you just one example of a service that the Communication Division offers, and that perhaps some of your members might want to take advantage of, and that's news media training. The news media has changed quite a bit over the last 30 years. Everybody's a publisher and broadcaster these days, but the basics of doing a news media interview and getting your message across in a professional manner, being able to stick to your message points, even in the face of some stiff cross-examination from a journalist, are still the same. So our media and public relations team can go out to county medical societies and train new officers, people who you expect will be in the media spotlight. It's free training. We do ask sometimes that the counties pick up any expenses we may have in getting there and coming back, and it also offers CME credit. So that's an overview of the services and information that the Division of Communication offers. Please stay tuned, take very good notes as Brent and David, Deborah, and Tammy tell you a little bit more about some of the specific projects and programs we're engaged in. Thanks.
Hi, I'm Brent Anier. I'm the Director of Media Relations and PR here at the Texas Medical Association. So when you think about TMA communications, my department focuses primarily on external communications, not internal to our physicians, although I'll get into that in a minute. Primarily external communications, which is to the public, to news media, lawmakers, stakeholders, people like that. So we do so primarily using news releases and things like that to communicate to the news media, to convey our TMA policy and positions and important things about medicine, and hoping to help them understand where medicine stands on these issues. And so, yeah, as I mentioned, news releases and statements and opinion pieces that we write and publish. We also work with reporters. We field interview requests, probably hundreds of them every year. We work with reporters from across the state and across the country, again, helping them cover the story right of medicine and patient care and why we feel it's important to improve the health of all Texans. And so we'll give them background information on what TMA policy might be on that sort of thing. And then we contact our physician leaders. We always want our physicians to be the ones who do the interviews in these stories because we feel like they're the ones on the front lines. They're the ones covering patient care. They're the ones working with patients every day, and they're the ones who know these issues so well. So sometimes in those situations, a reporter will contact us or an editor will contact us in a local community asking for an interview with a local doctor. And in those situations, you know, I've been at TMA a long time, as have my colleagues in our department. And so we have a lot of physician contacts of strong leaders across the state. But once in a while, in those situations, we will call you, we will call the counties, and we will ask for your input. Hey, have you got somebody that you can recommend to do this interview on whatever the topic may be? And so in those situations, we may call you and ask for suggestions, or we might simply hope to hand it off to you for you to work with the local reporters in those situations. Likewise, if a reporter contacts you and they're doing a story on, you know, something that involves TMA policy or that sort of thing, and you feel like you need some assistance, call me. Please call our department in the Media Relations and PR division at TMA, because that's what we do. We may not have talking points about everything, but with 40,000 pages of content on the TMA website, there's probably information about whatever that subject may be. And if we have policy on something, the TMA House of Delegates has passed policy on something, then chances are we have at least some foundation of information to give that physician who's doing the interview to impart that knowledge and handle those interviews the best we can. So contact us in those situations. We'd be happy to help. So a couple of the other things that people in my department work on. We contribute to TMA's social media effort, primarily our Twitter, Facebook, and YouTube channels. If you follow us at all on any of those social media channels, you see we post on a fairly regular basis because we do want to be thought leaders in organized medicine and patient care. And we use those venues because they're, you know, a lot of people follow us, and it's a great way to get our message out. I mentioned YouTube. We produce a lot of videos here at TMA. We have our own, we have a video studio, a green screen video studio with virtual sets, and TMA has its own YouTube channel, which is youtube.com/TMA Texas. youtube.com/TMA Texas. Now, a lot of the videos are patient-facing. As I said, a lot of what we do in my department is external to the public, and so we're in the midst of, for example, a monthly video series right now to educate people about the importance of vaccine-preventable diseases and getting your shots so that you don't get sick from these diseases. And we're talking about things like polio that so many people have never seen before. And so we feel it's important to produce videos on things like that to help educate the public. And so that's one example of the kinds of things you might find on our YouTube channel. But here's where we also sort of begin to morph into physician-facing or internal-facing messaging too, because we also produce a lot of videos aimed at our doctors. TMA's Legislative News Hotline, which is a weekly thing we produce during the legislative session to educate our doctors about what's happening at the Capitol and who's testifying on what bills and maybe actions that we are hoping that our physicians will take to help us to promote good bills and to spread the word about bad bills that are bad for medicine and patient care. So that's another example of the kinds of things that we'll put on our YouTube channel that is more physician facing. So we work to try to help them in that regard as well. Let's see. We also have a blog that is public facing again, meandmydoctor.com. I almost wince every time I say the name of that thing, but we named it years ago intentionally because we wanted that patient, that public voice to be first, even in the name. First person, the idea being that it is about me as a patient. It is about you as a patient. And so all the content on the Me and My Doctor is to educate people about healthcare issues that can help them and help them live healthy lives. A lot of our blog contributors are our physician leaders. So a plug to you, if you know somebody in your community who likes to write and write about medicine, please ask them to contact us, or you contact us. We love our physician contributors. We remind everyone we want this to be patient-facing, so the language has to be simple and patient-friendly. But whether it's about vaccines or diet or exercise or whatever, we love that content for meandmydoctor.com. So please keep that in mind as well. And the last thing I want to mention about what my department also is involved in is two of our TMA's longest running and most popular outreach programs, Be Wise, Immunize, and Hard Hats for Little Heads. We have a couple of outreach coordinators who work on those. So if we can help you with one of our initiatives, or if you have questions for us, please reach out to us. We would be happy to help. Again, my name is Brent Anier in the Department of Media Relations and PR in the Division of Communications. Thank you.
Hey, how you doing? I'm Dave Doolittle. I'm the director and editor of all of Texas Medicine Association's publications. So that includes a monthly magazine that goes out to every one of our members. It actually arrives in their offices, as well as a daily email newsletter, which consists of up to 5 stories. It's sort of like the day's news, and that can be targeted to specific specialties or regions or counties. So it's a member benefit because it informs both the magazine and the email, inform our members about what's important to them. The magazine goes a little bit longer in depth into stories, and the daily email is it's quick hit. Here's the news that's very important to this specific area of medicine. So if you have any stories or any information that your counties you might want to get out to those members, just send those story ideas or fully formed stories, whatever you may have, to me. I'm at david.doolittle@texmed.org. And send them our way and we'll get it out to our members.
Hi, my name is Deborah Heater with TMA's Communication Division. My primary job is mass communications. I manage all of the emails that go out through our email service provider and forums, including our daily e-newsletter, Texas Medicine Today, which during the legislative session includes the TMA Legislative Hotline. If you ever have a story that you want to share in Texas Medicine Today, please contact TMA's publication editor, David Doolittle, or myself. Many of your societies use forums for your emails. I'm always available to discuss email best practices or to answer any of your questions about how to use forums. If you are not an Informs user and want more information about it, please contact me.
My name is Tammy Wishart. I'm TMA's Outreach Coordinator. One hat that I wear at TMA is the Anson Jones MD Awards, which recognize outstanding health journalism. The awards have been around since 1957, and they recognize Texas journalists for doing an outstanding job of reporting on health issues when they get it right and do it accurately. Generally, the journalists submit their own entries to the contest, but we do allow TMA family members to nominate journalists. You can find more about that on our website, and you also basically just need to send me an email, and then it's a great way because they'll get a postcard. It gives them kudos for doing a great job, because they will receive that and know that you noticed what they were doing, as well as they will be entered into the contest. And it matters because about 1/3 of the entries that are nominated go on to win. So we hope you'll get involved.
I'm Lisa Stark-Walsh, Executive Director of the Texas Medical Association Foundation. My role at the Foundation is overseeing and guiding the fundraising, grant-making, and Board of Trustee activities that support TMA's vision to improve the health of all Texans. The foundation is a 501c3 philanthropic organization. It was established by TMA to visibly enhance the role and the impact of TMA in improving the health of all Texans. In short, we raise funds, and with those funds support physician-driven initiatives that support health and highlight the trusted leadership of physicians in their communities and around the state. We raise funds from individuals, other foundations, and corporations who want to be part of these efforts. My area of expertise is in communications, not-for-profit management, building and growing relationships, and identifying new funding sources, as well as new ways to build the collaboration among medicine, business, and community. The Foundation's activities benefit Texas physicians in several ways. One, we secure funds and bring the resources of like-minded organizations to participate in the programs we fund. This amplifies the reach and the impact that physicians have on the health of their patients and all Texans. Second, the Foundation supports not only the programs of TMA, but of county medical societies and alliance and medical student chapters. This provides physicians a unique opportunity to be represented in their own communities as strong advocates for the health needs that they see in their particular communities. We provide 2 opportunities each year for county societies and alliance and medical student chapters to apply to the Foundation for support of their own health improvement community outreach program. And third, the Foundation provides multiple opportunities for physicians to give back. We often hear from physician donors that they're grateful that TMA has a philanthropic foundation and they want to support these highly visible and impactful programs. And they also want to give back to a profession that they have felt is rewarding and has given much to them. They can make a tax-deductible donation to the work of the Foundation. They can participate in the programs funded by the Foundation, particularly Hard Hats for Little Heads, Be Wise, Immunize, and Walk with the Doc Texas. They also can establish a fund or an endowment at the Foundation for a particular health improvement project or provide general support to a wide range of TMA and local programs.
I manage 2 of our 3 outreach programs. The first one I manage is Hard Hats for Little Heads. It's TMA's longest running program. It's been around for about 25 years. The goal is to prevent head injuries and to help kids be active but safe while they're doing it. The program's motto is get moving, stay safe, wear a helmet. The goal of the program is to help our local communities have events to give away helmets to kids. We provide a matching amount of helmets for them. So when you buy helmets from TMA, you get more free. Anything up to 50 is an equal match, and from there, it's on a sliding scale. Our helmets, which you can see have our logo on them, are $7.85 a piece, and that includes the shipping. There's a special perk if you involve a family physician or a pediatrician. Those organizations that they are part of will provide up to 25 helmets, and TMA matches on that. So they can get 50 helmets at no cost to give away in their community. We do events all year long, but we have some special times during the month where TMA does some extra promotion to make awareness of the importance of wearing a helmet. Those are March, Brain Injury Awareness Month, April, Child Safety Month in Texas, May, Bike Month, and October, which we call Hard Hats for Little Heads Month. The other program that I manage is Be Wise, Immunize. The goal of that is to increase vaccination rates in Texas, and we do that through education and actual shot clinics. We provide a variety of educational materials for our physicians to use with their patients or in their communities. They can download them to their websites, and they're also available for local events. In addition, we have local impact grants of up to $2,500 to help you put on a shot clinic. The deadlines for that are March 1st, June 1st, and November 1st. We recommend you work about 4 to 6 months in advance if you want to apply for a grant. Both of these programs are mentioned monthly in our Giving Back newsletter. If you'd like to be included in that, just let us know. It gives updates and things that are going on in both of the programs.
I also manage one of our outreach programs, Walk with the Doc Texas. Walk with the Doc Texas is part of a national grassroots movement devoted to encouraging healthy physical activity. This program is free for TMA members and is available to county medical societies and alliance members. We post monthly updates about all of our outreach programs in our monthly e-newsletter, TMA Giving Back. All county medical society staff are opted into this email, but you can always review and update your profile on the TMA website at any time. Make sure your subscription is up to date by logging in and editing your interests. If you want any more information on Walk with the Doc Texas, please contact me.
Hi, my name is Karen Battori. I'm the Vice President for the Division of Population Health and Medical Education. Within that division, we also have the Texas Medical Association Foundation, which is the philanthropic arm of TMA. And my area of expertise is really primarily in policy development. We work with our physicians through an extensive series of councils. We have 3 councils in the division and about 10 committees that report to those councils. And we work on a number of very timely issues that our physicians bring to us through the House of Delegates process or through the legislative process or through whatever happens to be current, such as an outbreak or of infectious disease or issues with, for example, compliance with the electronic death certificates and that sort of thing. But primarily what we do is we work with the doctors to develop policy, so that includes report writing and research and analysis, building physician consensus on what the policy should be, and then making sure that we share that policy with the advocacy team so that they have a grounding for how to address legislation when it comes, or we use it with our communications folks, and however it can be used. I think the biggest benefit for what we do to our members is the fact that we are a very grassroots organization, and we rely on the doctors because the team that is in my division are not subject matter experts per se, and we are not clinicians. And so, in fact, that's the best part of the job, is getting to know what the physicians are telling us, where the important points are, what the science is, what the evidence base is for positions that we're taking. And so in that regard, the wonderful talent that we have with our physicians is something that I think any physician can offer to us, and we're grateful for receiving. The other thing I think that we have is a wonderful opportunity for leadership development, because physicians can take an issue and really run with it. They can testify with issues, they can present on issues, they can do a continuing medical education video for us. There's just a whole host of things that can be done with that if a physician really wanted to share their knowledge. And I find a lot of academic physicians very, very knowledgeable about a breadth of issues for us. So that's an area where I feel like we offer a real return to on investment to our physician members. And then I would guess what a county medical society would have an interest in from us would be leadership involvement. For sure, we have such a broad range of issues. They go from women's health to quality improvement and physician performance programs to anything dealing with public health infrastructure to immunizations. It's a huge area of policy work. I think the biggest challenge is narrowing what we do. And so in that regard, a county medical society that wanted to make an issue out of something, whatever it might be, we provide them with the input. I know that you're going to be hearing from the foundation, but they also have wonderful opportunities for community giving back, not only in the area of philanthropy, but also community-based projects. So that's it in a nutshell about the division.
Hi, I'm Margaret Mendes. I'm the Director for Public Health, which is one of the departments with Karen Battori, Population Health and Medical Education. I've been here a few years, but I'm still learning every day. I'm really fortunate to work with a very strong team of policy analysts that work with me to look at science and public health issues. Almost everything that we do comes from the physicians. There are issues that are brought to us through the House of Delegates process, Are there issues that doctors and medical students bring to us because they want a TMA position on it or information from TMA on what TMA can do, or does TMA need to do something? I will say that we're very faithful and fortunate that we have a strong governance process. I staff the Council on Science and Public Health, and that council has a very broad scope to look at science and public health issues. So that can mean anything from obesity, bariatric surgery, marijuana, vitamin D, supplements, all those kinds of things. So we look at a lot of different issues. The council has 5 standing committees that report to the council that deal with science and public health. And that would be EMS Trauma, Committee on Cancer, Infectious Disease, Reproductive Health, Women's Health. We also have a committee, I think I mentioned Committee on Cancer, Child and Adolescent Health. So we have just a broad scope of topics that are current right now. They're all very active. We're really fortunate to have really strong membership. So for the example, the council has 18 members. We have 7 or 8 consultants and special appointees. And what I really like about working there is that those members represent TMA. They're from all over the state. They're different specialties, and they bring the voice to TMA on all these issues. So we're really fortunate to be part of that process. The committees are similar. They're geographically diverse or different kinds of specialties. So we do have a very thorough process for working through issues in that area. The council also has the ability to appoint special committees or work groups to look at these issues. So for example, right now we have 3 different subcommittees that report to the council so that they can address very specialized activities. For example, several years ago, one of the physicians came to TMA and said, how are you addressing mental health issues? Well, we didn't have a mental health committee. So the council was able to appoint a committee to look at that and bring experts, not just folks that work in psychiatry, but primary care practitioners and others that deal with mental health issues and see that in their patients. So we're very fortunate to have that activity. Again, I mentioned the governance process that we have. Almost everything we do is policy related. We write reports, work with the doctors that instruct us on how to put these reports together. We then go through the House of Delegates process. So we also staff a reference committee on science and public health. And again, that's where these issues come forward. They're laid out, and the House of Delegates makes the decision on how we go forward. We also, the back end of that is once those items are considered by the House of Delegates, those that are approved, we take action on them. So that's where the councils and committees come together. So if there is a request, we need to know more about reproductive health, or we need to know about how marijuana is being used, then we start working on those. So at TextMed, we'll have CME presentations. Our staff will work with physicians on having those CMEs at TextMed. We're also working on CMEs in different areas right now. We have one that just completed on LARCs, on long-acting reversible contraceptives, and one on HIV screening. So very current topics. The doctors work on them, they bring those issues to them, and our job is to put them into place. Because a lot of it is sharing information with primary care practitioners and on other issues. So again, it's not just a policy review and the development, but it's also action on them as we've been directed. I will say part of our role too is we have to know what state rules are, and on the advocacy part. So this time of year, we're in legislative session. There are tons of bills that we're working on. All our staff are looking at everything from maternal health to school safety to firearms. Again, mental health is a big hot issue. So we're staffing those, and we look at those and assess them based on our current policy and what the members of our committees and our council direct us, what they think would be the evidence-based approach for physicians or the public health approach for TMA to respond. So it's a very busy time of the year, and especially getting ready for TextMed. There are many opportunities with dozens and dozens of positions on our council and our committees. We are always seeking representation from the county level because we need representation. We need many different specialties to assist us to look at these very complex topics. Even as a team, we all have experience and exposure to public health, but we also work with others here at TMA. We work with the lobbyists, we work with people in socioeconomics and other parts of TMA because some of these issues are so complex. So we really want to reflect what the best evidence there is out there to help physicians. I will say also I have a lot of experience working in public health, as do a couple of our staff. We work with the state agencies to figure out what is the best way going forward, or how can we make sure physicians are contributing and are supporting public health activities and helping them make them stronger and make sure they're evidence-based. I mention that in particular because we're very interested. There are a lot of state advisory committees and bodies and opportunities for physicians to participate. If you commit to one of our committees or our council, we're always looking for moving members into other leadership positions at the state level or other committees where their advice is needed on different topics. So we have members that work on newborn screening, that work on maternal mortality, that work on perinatal health, all those state activities that are so current, and they need physician leadership there. So I welcome any questions you have. Again, we encourage you, if you have questions on public health or science activities, we're always willing to work on them and get input from the physicians going forward.
I'm Marcia Collins. I'm the Director of Medical Education at TMA. I've been here since 1996. I serve as staff to the Council on Medical Education and cover all areas related to medical education. That includes medical schools as well as residency training. The Council on Medical Education keeps abreast of all the issues related to medical education and residency training. For example, each year they dig deeply into the match data to determine whether or not our residency capacity is keeping pace with our medical school enrollments. Graduate medical education capacity has been a major issue for the Council on Medical Education for a really long time. I also serve as staff to the Subcommittee for Academic Physicians. This is a working committee. It's composed of representation from each of the health science centers. That includes the medical schools, but also MD Anderson and the UT Health Science Center in Tyler. This committee develops materials that are of use to academic physicians, including curricular tool sets, CME courses, and this particular subcommittee also has a major focus on academic membership development. They serve as the membership liaison on each of the campuses. The last committee that I staff is the Committee on Physician Distribution and Healthcare Access. This is the committee that has responsibility for analyzing and reporting on physician workforce trends. We keep abreast of what is going on in terms of specialty distribution, rural-urban differences, and then we report that data on a regular basis. This helps give us a sense of where we need to go in terms of meeting our workforce needs. Please think of me if you have any needs in relation to these topical areas. We are here to serve you.
Hi, my name is Claire Duncan. I'm the Director of the Knowledge Center here at the Texas Medical Association. The Knowledge Center was developed in 2003 to be a one-stop shop for our members, their office staff, county medical society staff, and also even TMA staff. And so what we do is we provide information services to our members. We also provide membership services, education services, pretty much trying to be a one-stop shop for our members and their office staff when they call us. And so if somebody needs information about medical legal information, we can provide that. We work closely with our Office of the General Counsel to provide white papers to our membership on medical legal issues. We also work with our practice management staff to provide them with information about what our members are concerned about to help them develop education products. Members can call us to renew their membership, to update their demographic information. They can also call us to purchase Education Center products or register for seminars.
We also provide library services to our members, also to TMA staff and County Medical Society staff. Our librarian provides articles, research, and she also does County Medical Society CME application assistance. So when a County Medical Society is putting together a CME application, she can do the research that supports that need for that kind of education. The Knowledge Center is staffed by myself as the director, 2 information specialists, 1 librarian, our front desk coordinator, and our archivist and museum manager. The other thing that we do is we maintain all of TMA's archives, and we also have a medical museum downstairs on the first floor of the TMA building. To get a hold of us, you can contact us at knowledge@texmed.org. You can also call 800-880-7955. You can also access our FAQs on the website at texmed.org/library.